The rectal route involves insertion of a suppository into the rectum through the anus. Suppositories may also be administered the vaginal route, inserted into the vagina. Medicated creams, gels, or solutions may also be given by this route. In the ocular route, sometimes called the optic, the drug administered to the eyes. Medication is mixed with other substances to make eye drops or an ointment that is applied to the eye. Eye drops are easy to administer, but can run off the eye before the medication takes effect. Gel and ointment keep the drug in contact with the eye longer, but they may blur vision for some time. The otic route is used to administer medication to the ear. Drugs administered by this route are in the form of drops. The nasal route, tiny droplets of the drug are delivered in a spray. The droplets are then breathed in and absorbed through the mucous membrane linings of the airways. For inhalation route, the drug is converted into even smaller drops that are inhaled through the mouth to reach the lungs. The nebulization route is similar to the inhalation route. The drug is aerosolized or broken apart by pressure into small particles to reach the lungs. Special machines known as nebulizers create these small particles. The person taking the medication is fitted with a mask or uses a tube to breathe in a mist containing the drug. The topical route or cutaneous involves applying the drug to the skin. An ointment, cream, lotion, or gel commonly contains the medication. The transdermal route delivers the drug through a patch on the skin. The drug is absorbed through the skin into the bloodstream. This route allows the medication to be delivered slowly and continuously for hours or days. Patches are useful for drugs that are eliminated quickly from the body or when a constant drug level must be in pain. For example, pain control. Discuss factors that may affect how the body uses medication. Drug responses depend on the patient. A one dose fits all approach is not appropriate. Prescription drugs will relieve symptoms for some, for others, they may not be effective or may produce an allergic reaction or unpleasant side effect. Drugs may also cause different responses based on many different factors, including the following: age, weight, and amount of body fat a person carries, gender, family traits, genetics, metabolic rate, disease, diet, psychological issues. Age is the most significant factor in a drug dosing. Infants, children, youth, young adults, and the elderly process drugs differently. The liver breaks down a drug and the kidneys process the waste. The drug can build up in a person's body if these organs are not able to process the medication as quickly as it's given. This is known as accumulation and it can cause unwanted side effects. Infants are more sensitive to medicines than older children and adults. The organs are not yet fully developed. Elderly patients are also sensitive to medications. Drug dosage for young or middle aged adults may not be suitable for infants, children, or the elderly. Body mass index, also known as BMI, is a measurement related to a person's height and weight. It can estimate a person's body composition or the amount of body fat a person carries. A person's BMI is a significant factor in how the body produces and absorbs medicine. Some chemicals and medications are more or less active based on the amount of body fat a person has. Drug dosage are usually determined in a patient's total body weight. This is often inappropriate for patients who are obese. Careful observation of the patient's response to drug promotes patient safety. Gender also plays an important role in the body interactions with the drug. Generally, adverse drug reactions are more common in women than in men. At a given dose, a drug tends to stay in females at a higher rate for a longer amount of time than in males. Females usually have a higher percentage of body fat and their blood has a lower volume of water. These and other differences can change how the drug affects women. Gender differences are often overlooked when considering drug safety. It is important to be aware of these concerns when observing how a resident responds to medications.